and welcome. This is Vital Signs. I'm Dr. Nkosi Mtombeni, and signing with us today is Trifosa Ntswelengwe. On Vital Signs today, we focus on the COVID-19 jab for teenagers without parental consent and geriatric health. Coming up in the program, we'll listen to parents and children and hear what they have to say about children that will not need their parents' consent to get the COVID vaccine. Then we'll speak to Acting Chief Director of the National Department of Health about the decision that children can be vaccinated without their parents' consent. After this, we'll also listen to an insert produced by Zama Buthelezi, who spoke to two elderly people about the challenges that they face in accessing healthcare. We'll then speak to a geriatrician about the chronic diseases that develop in the elderly. Remember that you can be part of the show by simply asking our guests the questions that you have on your mind or sharing your views with us on anything that we're discussing. The number to call is 011-714-5861 or 011-714-5877. You can also share your thoughts with us on social media. And of course, you can use our Twitter, that's at SABC Vital Signs, or Facebook, SABC Vital Signs. Vital Signs will continue right after the ad break. Stay with us. Welcome back to Vital Signs. I'm Dr. Mtombeni. Children do not need a parent's consent to get vaccinated against COVID-19. Now, according to the National Department of Health, children between the ages of 12 and 17 can get vaccinated from the 20th of October, and they can visit any private or public facility. But let's take a listen and hear what the parents had to say.
No, I don't think it's right. I don't feel it's right. It told enough number of people that have died because of COVID. It's just, it's scary enough for our kids. So I don't think the kids should do a vaccine without the consent of a parent.
Mina ngibona kungenankinga ukuthi ba vaccinated because of vaccination angithi izokunceda bona ibavikela ku corona. So angiboni kuyinkinga, ngibona kuyinto right. Because vaccinate abantu abadala abantwana banga-vaccinate futhi inkinga.
No, it's not fair ukuthi bahambe bayo-vaccinate abangacelanga endlini. At the end of the day, asazi ukuthi this vaccine iphuma yaphi. So for me, it's a no.
Mina ngifila bad because abantwana bethu kusabantwana be-government. Umntana kumele aze kimi acele kimi permission. Mama ngicela ukwenza this and that. Mangithi no, I say no. Angeke i-government izongitshela ukuthi ngiyenzeni ngomntanami. Umntanami angeke azaye ayohlaba.
I feel ukuthi they must get our consent. Those are not the kids of the animals. The government doesn't own our kids. Those are our kids. So whatever happens to the kids, it must come from me. So mine are not going to vaccinate.
Health Minister Joe Pahla has announced that children between the ages of 12 and 17 will be able to access the Pfizer COVID-19 vaccine from today. But for now, they will only get a single dose. Now, the electronic vaccination data system will be open from Wednesday, today, the 20th of November, and they'll be able to get their vaccine at any of the current vaccine sites. Now, for more information, we're joined by Dr. Leslie Bamford, who is the Acting Chief Director at the National Department of Health. Welcome to the show, Doc. Nice to see you again.
Good morning, and good morning to the viewers.
Great. So let's start things off by talking about this new thing that has come in. I think it was announced a couple of weeks back where the idea that, these children between the ages of 12 and 17 would be able to go out and get the vaccine. But since then, what developments have come through?
So the announcement was made by our minister last week on Friday, but obviously plans have been in place for a while. So we know from international experience, many countries have started to vaccinate teenagers, in general, children from 12 years and upwards. And recently, SAPRA approved the use of the Pfizer vaccine in teenagers. And so we are going ahead. We know that although teenagers are not as severely affected by COVID as older adults, they do still get the infection. They can become severely ill. A small number of children and teenagers have sadly died from COVID, and they also play an important role in terms of transmission of the infection. So it seemed to be the right time to open up vaccination to our teens. We are hoping that many matriculants, those who haven't yet turned 18, will now take the opportunity and vaccinate in the coming days so that they are protected during their matric exams.
So let's talk about the approval process from SAPRA, the process that goes into saying that this vaccine is now eligible or can be used, is safe to use in these specific age groups as we've had from when the vaccinations were opened up. How do they get that information, and have the relevant studies been done in South Africa to say that this is a safe to use vaccine for children in that age? Let's talk science, because I think the big thing here is a lot of people want to debunk myths, and that's what I want us to do at this point in time.
So absolutely. SAPRA will always look at two issues, mainly look at the safety of the vaccine, and then whether or not it is effective. Clinical trials have now been done, so there is adequate evidence to demonstrate both the safety and the effectiveness of the Pfizer vaccine in children down to the age of 12 years.
So now, there are about 6 million children in the age group that's just been opened up. How many are you trying to reach, and how are we going about that?
Well, for now, as has been announced, we are opening up our vaccination sites so that children 12 years and older can access the vaccine. I think it is very important to stress that, particularly for the younger adolescents, we are strongly recommending that they attend our vaccination sites with a parent or other adult. We have made allowance that that parent or adult can accompany the child through the vaccination process. For now, we are not vaccinating in schools, partly because we know that our schools are very busy and focused on end-of-year examinations, and because we will be talking to our colleagues in the Department of Education. So for now, it's our vaccination sites, both the public and private sites, that will be providing the vaccination. As I've mentioned, we're really encouraging families to go and get vaccinated, both the adults and the children. Children can only receive the Pfizer vaccine, so they will need to access a site that does provide the Pfizer vaccine.
So let's talk about these children and the factor that you've just brought up, which is parents having to possibly facilitate the vaccination of some of the younger adolescents that come get their vaccines. What happens, and what are some of the obstacles that you're anticipating with respect to getting these children vaccinated?
So we know that some parts of the population are what we call vaccine hesitant, and that many adults are not yet vaccinated. And may not be encouraging their children to be vaccinated. So I think that is one challenge. But so as I say, we're really encouraging both adults and children to vaccinate. Our primary objective, our first prize, is still to vaccinate adults and to vaccinate those older adults, those over 50 and particularly over 60, because we know that those are people who are at highest risk for severe COVID infection. But we also know that if we are to return to any sort of what we previously considered to be a normal life, if we are to open up our economy, to open up sports and cultural events, that we need to vaccinate a significant proportion of the population. And so now both adults and children can be vaccinated, and we would encourage everyone to come forward and be vaccinated.
Okay, with respect to this age group, 12 to 17, quite young, and the issue has come about where a discussion of consent has to be put about. What does the law say with respect to this? Can a 12-year-old walk into any mall's vaccination site without a parent and get herself the vaccine, even if her parents don't know about it?
So the law is extremely clear on this issue. The Children's Act states very clearly that any child who is 12 years and older, provided that they have an understanding of the benefits and the risks, can consent to medical treatment and should consent to their own treatment. So the law is extremely clear on that matter, and that is why we have indicated that there is no legal reason to not vaccinate a child 12 years and older who requests vaccination and has some understanding of the risks and benefits.
Okay.
But of course, that's not the ideal scenario. And as I have already stated, we would really encourage parents to assist their adolescents, particularly their younger adolescents, through the vaccination process.
Okay, we have a question from a caller, Steve from the Northwest. Good day, Steve.
Hello.
Hi, Steve. Yes, we're listening. What's your question, sir?
My question is that I didn't have a question. I want to add to what the government is trying to do now, to vaccinate children from the age of 12 to 18. To the parents, I would like to say, parents, allow your children to be vaccinated, because this is, if you can listen to the music of Chola and PJ Power, they said, give the children education so that they can survive for the rest of their life with education. If you teach your children not to accept the vaccination, which is a mahala gift for their lives, because I know some of my neighbors, they said they are not going to take vaccine, and that is what they're going to do with their children. So if the children ask you, as a parent, that I need to be vaccinated, please give your child that chance, because he's asking you. He knows what he is doing.
All right,
Thank
Steve,
you.
quick question to you. Did you get vaccinated?
Yes, I'm vaccinated in South City.
All right. Have you gotten 2 jabs or 1 jab?
I got to 1 jab. What is that?
Okay, so have you gone out and actively trying to get members of your family to go out and vaccinate? Is everyone in your family vaccinated?
Yeah,
what have you been doing to
all
improve, people in and around you getting the vaccine?
Yes.
Steve?
Yes, I have made that thing. Because even in Katlin FM, I even talked to the people at Katlin FM for Wakata. I said, people, please, when vaccine. My whole family and my siblings are all vaccinated through my effort.
Well, thank you. It's great to hear that, Stephen. We're really grateful to have people like you that will go out and really encourage people to go out and vaccinate. And I think this is the same thing that we need to have with respect to the younger population when it comes to vaccines as well. What are the actual numbers looking like with respect to the rest of the population, Dr. Bamford, with respect to getting vaccines?
So the vaccine rollout has gained traction, and we are starting to see a significant number of proportion of the population vaccinated. So sometime last week, I think it was, we passed the milestone of having administered more than 20 million vaccines. So just over 1/3 of adults in South Africa have received at least 1 vaccine. So that's a significant dent, but it means that we still have 2/3 almost of the adult population to vaccinate. We've vaccinated more than 60% of those over 60 years of age. But again, we really need to have a higher coverage by the end of the year or beginning of next year, when we anticipate that we will see the 4th wave of the COVID pandemic.
All right, look, we'll continue this discussion after the ad break. Of course, that's Dr. Leslie Bamford, who is at the National Department of Health. Do stay tuned. We'll see you after this. Welcome back. This is Vital Signs. I want us to go have a listen to what the children had to say about receiving the COVID jab, maybe without their parents' permission.
Mina ngokubona kwami itile into leyo ayikho fair yabo. Mara mina anenge ngivaccine ngicale ngizwe ngomzali wami yabo ukuthi uthini. If akavumi or if uyavuma mina ngokwami angeke ngihlabe ngoba le vaccine le ibulala abantu abaningi balibele bona bathi i-vaccine yokuqeda le COVID ayikho lento le mina for mina le COVID hayi into engekho.
Firstly, I'm not going to vaccinate. I don't think the vaccinate works because you still get corona even if you vaccinate. And the thing that you don't tell your parents about the vaccination is just not on. Because you need to get the permission from your parents, and they also need to be sure that it's safe. So when you go without their consent, it's just not on.
No, because we need our permission to our parents to vaccinate.
So are you going to vaccinate? Are you scared?
I'm feeling bad about vaccinating. I'm so scared to vaccinate because I think it's not safe to our bodies.
Mina ngifila ngathi mele sikhuluma nama-parents wethu before sivaccinate. Ngoba mina ngifila ngathi le nto le ayikho safe. And mina ngibona ukuthi ngisazovaccinate.
Angicabanga ukuthi ku-right because kumele sikhulume nabazali bethu. Uma kungayenzeka into wrong kithi, isala nabazali bethu, ayisali nabo. Maya ngeke ngivaccinate
no angeke ngihambe ngoba umzali wami demele ayazi mangiyakho vaccine ngoba uzoba ne stress mangingamtsheli and angeke avume ukuthi vaccine.
Mina ngeke ngiye ku vaccine ngoba angiboni ukuthi COVID iyasiphatha thina intanga zethu phatha miba abantu abadala.
Yeah, quite interesting views from the younger population with regards to getting the vaccine potentially without their parents' go ahead. But let's continue our conversation with Dr. Leslie Bamford, who's the Acting Chief Director at the National Department of Health. Doc, we continue the conversation. I'm not sure if you could hear or see what the young ones were saying with regards to getting the jab, potentially without their parents' consent. But a lot of views live in and around. I think one of the children said he doesn't believe COVID exists. The other one said the vaccine will make you sick. The other one added that, children do not get COVID. How are we addressing all this misinformation?
So it is an important issue that there is a lot of misinformation around. As we said earlier, it certainly is true that children tend to have milder COVID infection. But we know that certainly during the third wave, we saw an increased proportion of COVID cases and COVID admissions being in the younger population. So COVID certainly does affect children, particularly teenagers and adolescents. It is usually milder, but we do see some severe cases and some deaths. And we know that the vaccines are effective and safe in children. One of the really negative effects of the pandemic and the restrictions that have been put in place has been on our children's education. And we, as government and as society, we need to work very hard to try and make sure that children can be going to school safely. This also affects our tertiary institutions, that students can be attending lectures in our institutions of higher learning. So all of these factors taken together, we do really need to work very hard to ensure that our adolescents and young people are protected from COVID infection.
Okay.
I think the young people in those inserts spoke with a lot of maturity, and we certainly are encouraging children, adolescents to talk to their parents about vaccination. As I said earlier, we would encourage parents or other adults to accompany their children to either to get vaccinated together, or if the adult has already been vaccinated, each child can have an adult with them as they go through the vaccination process. So we certainly support the view that children should discuss this with their parents, should get their parents' permission. I think the issue around consent simply comes up with the fact that the law itself is very clear, and the law states that children over 12 can consent to medical treatment even without their parents' permission.
Okay, we've got one more caller before we let go of you, Dr. Bamford. I know you've got a very busy day ahead of you. David from the Western Cape, hello.
Yes.
Yes, sir. How are you today?
I'm here. I'm good.
Good. We're listening. What's your question? David?
Yes, my question is, I hear about the legality of the children over 12 years old that can get the jab without permission. Right. But I want to know who's going to take responsibility if the children are going to get sick from the jab. Because I hear the jab is not like 100% foolproof. You won't get sick. There's a possibility that you won't get sick. Now, who's going to take the responsibility?
All right. Thank you, David. Quick question to you. Have you gotten vaccinated?
Yes, I do. I did.
Did you experience any side effects, any symptoms, anything like that?
Yes, the left arm, which I call the corona arm, the main artery. I experienced some problems with that. It's been paining, and I've also got arthritis in my fingers after I've got vaccinated.
Okay, thank you, David. Let's hear what Dr. Bamford has to say about that. So who takes responsibility for if anything happens to a 12-year-old, 13, 14, or whatever it might be, who has gone to get the vaccine without their parents' consent?
So we know that the side effects, some people do have mild side effects following immunization. These are flu-like symptoms, and they should resolve within 48 to 72 hours. We do sometimes, there are people who may experience more significant side effects. Anyone who suffers any side effects should present to one of our health facilities and will be provided with the necessary treatment. As I'm sure you are already aware, we do take any side effects or adverse events following immunization very seriously, and anyone who does experience any such events should make sure that they are reported so that they can be investigated by ourselves in collaboration with SAPRA.
All right. Thank you so much, Dr. Bamford, for joining us this morning. Just to give us an update on what is happening on this 20th of October as we look at the age group of 12 to 17 being able to register and going out to get their vaccines. An important thing to note, though, however, is although they can go get the vaccine without their parents' consent, it isn't something that is largely an issue in that regard. It's just a children's rights issue, just to inform the children that if their parents, for instance, feel that they shouldn't be getting the vaccine, they themselves, over the age of 12, are able to go out to a facility and get the vaccine. Not that, the schools are going to give, or the facilities or any of the vaccination sites are going to give your children the vaccine without your consent. It's an important thing that I think we just need to get across. We continue with more conversations, and we'll be looking at geriatric care right after the ad break. Welcome back. This is Vital Signs. I'm Dr. Mtombeni. As older people age, they have this different health needs compared to younger people. The South African elder care policy places a strong emphasis on aging in community rather than institutional settings. In South Africa, primary healthcare systems may not be geared to address these health needs of older people living in communities. Are they? Well, Zama spoke to two elderly gentlemen from Soweto about this. Let's find out what they had to say.
Elderly Diepkloof Soweto resident Baba Samuel Zwane has lived with a chronic illness for years.
Definitely they are run in the family. The chronic condition I have is high blood pressure, the silent killer. In 1963, I lost my dad because of it. In 1978, I lost my mom because of it. So I'm also having that chronic disease, but fortunately, it's under control.
Zwane's elderly neighbor Ntate Gilbert Moeti hasn't been spared.
It close to 20 years. 20 to 22 years. High blood. Both of them.
But how has Zwane managed to live a healthy life with hypertension?
I attend my appointments on the set dates so that they must check me up. And that's where I get told that it's under control.
As an elderly citizen, Zwane is not happy with the service offered at his local Diepkloof community clinic.
It depends on your lucky day. It depends on your bad day. Like I say, sometimes you come there at 7, at 10 o'clock, you're gone. Sometimes 12:30, 2 o'clock, 4 o'clock. Sometimes it's a carryover. They say, no, come back tomorrow. You guys are going to be the first people in the queue.
Moeti echoes Zwane's words about the frustrations with the Diepkloof Community Health Center.
It's so bad. This clinic business. You must wake up 6 o'clock, 7 o'clock. You must be there 7 o'clock. But to 2, 3 o'clock or either tomorrow.
Moeti says complaints about the shoddy service at this facility have for years fallen on deaf ears, and as the elderly, they feel mistreated.
Government don't listen nothing. If government was entitled about this, all these things could be easy. What are you coming to do? I'm doing this and this. Finish. What are you coming to take? This and this and this. Finish.
More than 9 in 10 older adults have some type of chronic disease, and almost 8 in 10 have more than one. So chances are you'll probably get one at some point in time, right? But there are things that you should probably do to live a healthier life, and also come across some common problems that can sneak up on us as we age. For more on this, we're joined by Dr. Laura Greenstein, who's a geriatrician, and let's find out from her what big issues the older population has. Good morning and hello to you.
Hi, thanks so much for having me.
So let's talk about aging. What does aging involve? What does it mean when we say you're part of the aging population? What is that?
Well, it obviously means that in years you're getting on. So it's more than 65 years or older than 65. Mm-hmm. But it also means that your body starts slowing down a little bit and your reserves become less. So you're more susceptible to a whole host of chronic diseases. Mm-hmm.
So when does the body start giving up? I don't want to use that term, but I mean, it feels as if, you get to a point where you've been fine your whole life. And I mean, a lot of friends have told me, your life is great up until you're 30. After 30, when you get up, your back's a little bit more sore, your knees aren't playing the same game that you're playing. When does all of this start coming into play?
Oh dear, I hope it's not 30. Technically 65. But we'd like the body not to give up until much, much later on, preferably not at all.
Are there different ways in which we age? Men and women, races perhaps? Are there different ways in which people age?
I think it's more of how you look after yourself when you're younger and the type of lifestyle you have. whether you've got good genes or not.
Mm-hmm.
It's a whole host of environment and genetics.
So what does then the discussion around metabolism come into play here and do? I mean, a lot of people find out when they're in their 40s, 50s, maybe even 60s that they have this chronic condition. But I think a lot of the problems come in that a lot of these chronic conditions aren't obvious. You know, it's not like you have a broken hip and you know that there's pain in that area. If you have high blood pressure, you don't know you have high blood pressure. So how do you go around finding out about all of this?
You know, you have to get your yearly checks. You have to go have your blood pressure measured, your cholesterol checked, your sugar checked to make sure you don't have diabetes. At a certain age, you have to have your bone health checked to make sure you don't have osteoporosis. So it's a whole lot of preventative medicine, which is really important.
Okay, and what can people do, whether you're nearing 65 to be regarded as someone that's in the geriatric population or you're a younger person, what can I do to ensure that as I get older or when I am older, I don't have these big problems?
You know, you have to start when you're a lot younger. You have to exercise properly, eat healthily, don't drink too much, don't smoke, you know, take vitamins, reach your educational potential to keep your brain healthy, be socially active and interactive.
So let's talk about some of these conditions that, you know, the older population may have to deal with at some point in time. What are some of the common problems that you've had to face?
Well, dementia is really important when it comes to the older population. And then other conditions like osteoarthritis, osteoporosis, falling, you know, then the normal high blood pressure, diabetes, hypothyroidism, and a whole host of other conditions.
Right, so I want to look at a couple of the ones that you've mentioned with regards to, you know, the older population getting these. Let's talk about dementia. I think it's a term that a lot of us hear quite often, but don't necessarily understand what that is. Can you tell us a bit about it?
So it's a decline in cognition that leads to an impairment of function.
Yes.
So if your memory, you know, gets worse with age, and then you're not able to like socially and occupationally interact as you would have normally.
So what is the cause of dementia? Is it just a given that when I am 85, I will have dementia, or how do we go about, you know, making sure that I don't get dementia?
No. So absolutely not. It's definitely not a given. Obviously, as you get older, the likelihood of you getting dementia increases. So when you're 60 years old, your likelihood is maybe 1%. And then by the time you reach 85, it's about 45%. But there are different types of dementia. So dementia is the umbrella term. And then under dementia, there are a whole lot of causes. So I think most people are quite familiar with Alzheimer's dementia, which is the most common. And then there are things like vascular dementia, which is like little strokes in the brain. And then there are more specialized causes that you would have to go to a specialist to be diagnosed with, like frontotemporal dementia or dementia with Lewy bodies, and then dementia associated with certain diseases such as Parkinson's disease.
Is there any way I can reverse any of this as I am older and find myself to have maybe decreased cognition and those sort of things?
So 40% of dementia is preventable, but it's not one thing. It's a whole host of things that you have to do throughout your life. So when you're younger, you have to reach your full educational potential just to strengthen your cognitive reserve.
Sorry, what does
then
that
when
mean?
You get on
what
to
does
middle
full cognitive potential mean? How do I reach my full cognitive potential?
Well, you have to, so if you reach your educational potential and you learn as much as you can when you're younger, your brain is healthy and there's more normal connections are made, and it just leads to a healthier, stronger brain.
All right. And if I'm older, is there any way I can improve my neurocognitive function?
So, you know, things like high blood pressure and diabetes really do take a strain, or the brain takes a strain with conditions like that. So you have to control them if you do have those diseases, or try and prevent them if you don't have them. Make sure your cholesterol is under control. Don't smoke. Don't drink too much. You know, make sure that your hearing is checked, because if you can't hear, you can't really interact with the world around you. Make sure that you're not socially isolated, and that you keep in touch with your friends and do hobbies that you enjoy doing. try not to be around too much pollution, which is difficult. But those are the things that can potentially, that can cause potentially reversible, there are potentially reversible causes.
What are some of the big things we need to look out for when we are with an older family member and we potentially think that this patient or this family member might have dementia? What are the big things to look out for?
Often the patient or the person themselves will complain that they're losing their memory, or the family will notice that they're losing their memory. It's normal to forget, where you put your keys, but you do eventually remember that you put them, on top of the freezer or whatever the case may be. But when you can't remember, and if it's impairing your function, so you're missing appointments, or you forget to take your medicine, or you forget where you're going and you get lost when you're busy driving, that's a warning sign to say, oh, there might be something wrong.
Okay, so that's the brain issue, and I think we've covered it quite well. Let's have a discussion around bone issues. I think it's such a big issue that older patients or older people in the population really complain about. The sore knees, the sore ankles, the sore necks, fingers, toes, every part of their body is sore. What is osteoarthritis?
So osteoarthritis is a degenerative condition that causes loss of the bone cartilage, and then the bone rubs on the bone and it causes pain and impaired function.
So how do I get to a point where bone is rubbing on bone? I've heard you say it's degenerative, but if I've never run a marathon, I didn't play any physical sport when I was younger, all I do is I walk places, I'm physically healthy, no real issues with me, why do I keep complaining about my sore knees and sore ankles?
It might be osteoarthritis, which is an aging process, but it could be something else as well. So there are other causes of arthritis that we do need to be aware of.
So we've got a call from the Western Cape. Good morning. Ravens?
Ravens, thank you.
Yes, we're listening. What's your question, sir?
No, I gave you my question.
Pardon?
I said that my right leg.
We're listening.
I have the vaccination.
Okay.
And my right leg, the vein is pushing out, and it's very knobby. And I don't know if it's my old age or what. But since I had the vaccination, my right leg, the vein is pushing out only on my right leg.
Dr. Greenstein?
Hey?
A gentleman from Cape Town had his vaccination and now his right leg is not working the way that it used to work. How do we go around this? What do you think is going on?
Well, I'm not sure if it's a vaccine-related issue or if there's something else going on. I don't, he would need to have a checkup at his local clinic to see whether it's a bone problem or a muscle problem, or if one of the veins is a little bit inflamed. It could be a whole host of things. He does need to have it checked out.
All right, thank you, Dr. Greenstein. We are going to continue this conversation a little bit later. Of course, we're going for a quick break right now. And when we come back, we'll wrap up our discussion around care for the elderly with respect to their health. See you now. Welcome back. This is Vital Signs on SABC2. We're talking about geriatricians, right? Not necessarily geriatricians, but we have a geriatrician and talking about geriatric health. And this is why we have Dr. Lara Greenstein here to wrap up our discussion for the day. Doc? Yes, so let's continue our discussion. We're talking about osteoarthritis before the ad break and, of course, all the issues that come with it. So what is the major cause of osteoarthritis?
Well, older age is the major cause of osteoarthritis.
Dr. Greenstein?
Oh, yes, sorry, I just couldn't hear you for a second.
Oh, no, I'm saying, so you're saying older age is the main cause of osteoarthritis, but what does that mean? Does that mean when I'm old, I'm going to have broken everything and I'm going to feel sore all the time? Or
no,
are there ways, yeah.
It's just wear and tear. So as you get older, you get a little bit of inflammation and the cartilage gets a bit dehydrated and starts wearing thin. So I think just to keep active and as healthy as can possibly be, eat a good diet with lots of vitamins and minerals is probably the best way to prevent osteoarthritis.
Mm-hmm. Another thing that's quite popular and a lot of people speak about is osteoporosis. What is osteoporosis?
So So osteoporosis is a weakening of the bone, so you get a lower bone mass and lower bone quality, and this leads to weakened bones and a propensity to fracture easily.
Who's more likely to get osteoporosis?
So also older people, females, people who are very thin, people who are deficient in calcium and vitamin D, people with certain medical conditions who are on certain medications, people who drink too much, who smoke too much.
So how do you get to a diagnosis of osteoporosis? How do I know that my bones are a little bit weak or my bones are not as strong as the person next to me?
Well, unfortunately, a lot of people realize they have osteoporosis once they've already fractured and broken a bone, which is what we don't want. So we recommend that women who are over the age of 65 or men who are over the age of 70 go for a special scan called a DEXA scan, which just shows you the quality of your bone and whether you've got osteoporosis or not.
Is there a genetic component to osteoporosis? If my mother has osteoporosis, does that mean I'm going to get osteoporosis?
Well, if your mother has had a hip fracture, you're much more likely to have osteoporosis. So there is a genetic component.
Okay, and how do you go about treating it as well as preventing it?
Okay, so to prevent it, again, you have to cut down on your smoking and your drinking, and you have to eat enough calcium and vitamin D. Make sure that you're not too thin. Do good strengthening exercises to keep your bones and muscles nice and healthy. And then to treat it, obviously, if you're deficient in calcium and vitamin D, you'd supplement that. And then there are certain medications that we use depending on your age and your what other diseases you have. There's something called bisphosphonates, which you can either give by mouth or as a drip once a year. There are a couple of other options as well.
All right, let's talk and wrap up the discussion. And I want to talk about autonomy. The fact that, older people do get older and some of them do get dementia. But the big issue is who takes care of these people. It's quite difficult, I think, towards the end of your life when, you have a house that you live in, but the kids are all gone at this point in time and you should be looked after. So what and how do you address issues of autonomy and older people taking care of themselves?
Firstly, our aim is to try and make older people as functionally independent as possible and for them to carry on their day-to-day lives, as they were for as long as they can. When you get older, I think it's important to start having conversations with your family and your loved ones to try and preempt some of these problems before they happen. So tell your family, when you get old, would you like a family member to look after them if you're not able to look after yourself? Would you want to go to an old age home? Would you rather have carers in your house in the event that you can't look after yourself? I think the person themselves must make as many decisions as they can when they're able to.
So what is the benefit of community care or being looked after in a community setting versus an institutional setting?
A community setting, you with your familiar people and with your familiar things in your home environment, you sort of have your routine that you've always done. It's a much nicer way of living. You don't have to uproot your entire life. I mean, sometimes it's really necessary, but if you are able to carry on living in the community, it's very beneficial to the person themselves and the people who are helping them.
Do older people need to be taking some sort of vitamins and minerals and all these sorts of things that you can buy over the counter at these pharmacies, even if they have tested and found themselves to not have any deficiencies?
So if you're deficient, you don't really need anything, but I mean, a good multivitamin isn't going to do any harm.
Okay, and any other things that you would potentially, prescribe to patients that are coming and seeing you at your practice?
Well, if you can prescribe exercise and diet, I think that's really, really important.
Yeah.
So a good Mediterranean diet, not too many fats and more healthy oils and vegetables and fish and that sort of thing. And then exercise to keep strength and training specifically and to keep good balance and that would be number one. And a good multivitamin doesn't do any harm.
Well, thank you very much, Dr. Lara Greenstein, for joining us today, talking about geriatric care and making sure that we take care of our older population. If you're sitting at home, you've retired, life is good, you may have a knee pain or an ankle pain, or your arthritis keeps popping up here and there, just go out and see someone. I think these health facilities exist, and a lot of these government health facilities as well actually offer, special lines for older patients so that they are seen quicker, so that they are attended to quicker, and so that they can get out and go live their lives the way that they want to live them. And of course, let's go out and look after the old people in our lives. Thank you so much for all the guests that decided to join in today and participate with us. And thank you for joining us and watching Vital Signs. Remember, we are still in a pandemic. It may seem like we're not, but let us make sure that we look after each other and protect each other. Remember to stay at home if you don't have to be out, social distance, and as the weather's getting warmer, keep those hands clean and continue to wear your mask. I'm Dr. Musa Mtombeni. We'll see you when I see you. Goodbye.